Jumedie no. Yasesem free said yes and no. Today we will be dealing most with your audience. No, it wouldn't be in studio discussion. We would like you to send us your COVID experience. Say who contracted COVID maybe or in any way related to COVID. No, your experience with it, as in from 2020 till date. Share with us na yen so ye intimate kaima ya hefo na yen discuss it. Ebiem so no ye be frɛ health workers too aka ye ho na ye ni omo atwetwe nkomo ye be di kan afrɛ Dr. Davidson da bia ye ni no edi nkomo odwumadi esu ɛna ye be sa afrɛ health worker ba ko bia bibi nti no ye ntimi emfa ne din entudwa. And also during the period of COVID, no, or contract TB. So, or be sharing the experience with us in a short while. Now, my main ender, my guest in the studio, Eddie Entre Mahefo. He's not new to the show. He's a familiar face, but I'm a friend of the backbone of the show. Everything runs pally. But yeah, we hear TV and I say we screen so. Or no is the face of it. Behind the camera as well, we have the face of the camera. But on screen, no, he's the face of it. Osei Agyemang.
Yeah.
And then some massage wakunya.
They be average.
Now what you willing to say?
Oh, it was quite tough because 9 shifts. And then weather no. Yeah, it was tough, but God being so good. Affirm.
Ningina ye beda wase se bibia echi na adwuma sem ne obrenyina echi no unya ekwan ma ye na wo be kire ye about health and other relating stuffs. And then you say you be discuss COVID.
Yeah, COVID-19.
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 Yeah, bring the interesting side of the story to our viewers. We are not going to talk about the definition and we will talk about it briefly. I know the GD say over in the course of the year and we've heard about it, but we would like to talk about what people are talking about COVID on the streets. People say COVID was never real. People say see the people say affected blacks. People say react to me no and all that. We want to delve into that side.
And you know one thing, I was privileged to be part of the COVID-19 contact tracing team. Time Anna, a month for shed them, no. We were out. We saw what happened. Even there, of course. So I was privileged to be part of the COVID team. Yes, you call Gofufi. Omo ma contracted COVID no yeah cost omo time ana lockdown no e wo ni peak no na lockdown no ejina mu den no na ye wo abanten ye wo hospital we fifi ye hu there e course into no one topic I'm very passionate about it. Yeah, I'm very passionate about it na me da was so say one makonya no say membra na ye medisa enkomo we
me kai say emre bi woni me di time anamoye contact tracing no mo challenges ne said ye na mo si koni nyina no woni me edi ho nkomo na ene no me won sem bisa bebre
okay
said be ya ye viewers better asenti no ye be hwe time ana oka COVID front liners ne ho no ye be hwe sa time ne mo challenges am face ye ne difficult people am encounter how you dealt with or more. But to start with no me during my research on the topic, you know, one thing I find intriguing the numbers.
Yes.
I want to start with the numbers.
Yes.
I want to start maybe you'll be a time and share statistics on COVID and all that. No?
Yeah.
And let me briefly read what I found on the internet and share viewers. I say the statistics now, no. You say nipa 183 million. But you won't find Chamina and no tree ne can be den kaka. Nipa 183 million. And I contracted COVID from first time infection no eba to date. Nipa 183. And a nipa ahre omunkwa because of COVID and so yeah 3.97 million. 3.97 million.
Wow.
And our countries are a leading so US, which has 33.7 million infection cases and 605,000 death.
Okay.
Ghana being can't say being lucky in a sense. Me talking on one part say in relation with the numbers, no, yet you know, our formers compared to your cases ning na 95,914 and our death no in 796. And see your take on the numbers because I find it alarming. Say COVID Benjamin himself call for chin call for but major research na me who number we know. I was a little bit shocked. Say, COVID didn't take such a huge number of the world's population. Free year, say. Now, Monsuka, I'm battle with the infection. No, figures and so. And see, what's your take on it? The numbers.
Okay. As compared to other African countries, you know, your numbers, no. Quite lesser than the others. The say COVID nipa bebree wo other countries. Ghana as at now no nipa 796 and ashura monkwa. Emu 93,444 and it's no compare numbers new to other countries na just say Ghana ya boy ho modern kakra but akakakra say ye wo yensa ye practice social distancing say ye feel cold ye nya cold flu bia ye mben nipa ene na say kra wona ma oben so bia wo sanitizer shene the bag man ase ni bottom also scam we bibi kakra bia na opepa nensa town fine e bia so den de e bi mbo nose mask but nipa bebree na I think the Ashanti region almost 85% of the population here and aya ebo nose masks according to Ghana Health Service. I mean nim omo yes we need here.
No brings me to my next question.
Okay.
Is it because yeah be right? We've been doing the right thing. Entina your numbers no form compared to
other countries.
Other countries now say we are just fortunate. And as I said, the Nkofosi can weather nenso to me influence ne.
Okay. Make classify no under two. Say fine. We've been fortunate. And the other is yes di emran so kakra. Cause ubu okra ni fie animu bedru ni main gate na wo Veronica bucket or soap or tissue paper or run say we are or the ever paper. Oh, to say kra na you who say COVID na echo from kra. Abreso new variants abano echo from kra. Baby wo hoso so a yen allow Emma munye overcrowded public places, even churches kra no. Asori bi abewe mu bia do yama kwan say yenye asori, but asori bi abewe mu bia no still na ye practice social distancing. Ye share face masks. Your sanitizers or your Veronica buckets are in so womb you be running na ya wash hands. And you know, me only say we are doing things right. You get it? We are doing things right.
It means we are on the right track.
Yes, we are on the right track, but akakakra. Yes.
In your knowledge as a health professional. No? Yema Benz need the hin aka the kahua.
Oh, okay. I can say, first thing meka practicing social distancing. Say yem ben Ghana World Health Organization say nipa ne dos na wo no at least I was say obia yetumitete entamu by 2 meters. 2 meters no
we doing it
on sa.
Are we doing it? Are we practicing the social distancing?
The thing is yeah mind mu no yeah aha no practicing social distancing no e den kakra o tena trotro ma bra push na metra won chen onam town and how are your town no your crew no your planning no so no emwa for social distance KJT na akwa social distancing emfa but yeah no enkakan ena ensa so hohoro no so cause baby abeku bia no ubenya ayi wo ho Veronica bucket and so ubenya soup kakra e wo honom and Ghana for are there with hand sanitizers baby abefa bia hand sanitizers ho ena nyame adom nose masks ne bo aba fom say fofofo etino Ghana for so Ghanaians are obeying cause even what natural mu kra na omo mbo nose mask no kra no obi wo nose mask e den obi ombo kra na obi wo ne nchen ombo kra na obi wo ne nchen so we are on the right track and to say me di kan kai no aka kakra
wa kofa max asem abaide mame emisa say yo ka say ne bu aba form ne ebi mu kra nim hye
yes
say dey si hye no
yes
obi o ha be huna ene de bona o de akata enwi so aboje say ase obi o nso ene kata na no no agya ne ne say nkwa na esi hye no ena max ne nso no ye wo ukota we bi wo ho de hye bi wo ho de hye yi kra na o sa wo the same thing wo ho but obeyi we am say we mu edu chain we eno no nso so ye be ne dantem ena de hi na wo se hye
okay
say colors be bra ba ye wo black red blue yellow de hi na wo se hye
okay max na ye hye no ni nyina ne say a prevent droplets Veronica say droplets ebia oye 18 sebi o ye 18 a uwizi a oh de be free wo huni maba woni maba no em free won chan enko baby foforo ha no that's the main reason why ya bomb max no and coronavirus no airborne and I'm from max no ya K95 K75 ya wo de aboboye bi ni aye frɛ no surgical max ha ana ya wo de de entoma ni bi yan di kambra entoma de ne so entoma max no obi a obeka entoma max ne nya papa bia oboa papa but how ubisi handle entoma max no ubituma bo entoma max no but upie abonten na obefia onwa unsu hye kakra odi atum na wasi usiwia ye fra bibi chlorine solution bibi na ye fra ni bleach e ofie bleach kakra na odi atum odi tum cha ebetete that tum kakra be 2 minutes bi na wayi na wa renze na odi asan awiam se de be awia eboboso na eno also usi no time bia obehye bia no se mi pie me bo entoma max na mi pie sisi a me ba fie a na me se pie bie ma anase me ba fie a mi yi a e wo se mi si eye de me kan ni nyina ansa na masa afa abo je me kan se ahweforte ansa na mafa abo enti eno no ene esi enenam ontimi mbo entoma max enyi nto ho enkone na ma upia wasa befa asa abo eni mu sei no ehuni say ho ne ye highly contagious aha no ehuni say emo ano wo ha ti me kona me fa na me pruprum na me sa de bo a me ana me sa de ema me ho
ha
ana ye frɛ ana we no so surgical mask de ebo boy no ye hye nto aso mienu
o sheba pe o say
sheba ko pe o so sesa no
okay
ye hye nto aso mienu but aha no eno ano ya ba but
yes
yes me won say obi asi ahata da
obekọ no ahata no be 15
yes yensi boy I will come by and way a disposable friend disposable face mask no
okay
and a K95 and a K75 na eno no so yensi say ahwefo ehu a max you maintain am fa bia amba max white na ano no ye fia say no
emu na edu kakra
yes and esa wo ventilator ebo nchen ba bia ohumi a emframa no
okay
ebefa eno so sa yensi na eno kra no opese wo sa reuse a o de to enso hye mu sa na se bleach kakra na o de egusu na wa dry na
wetimi asa ahye
use na max ne so ye what technique e de hye max no obo oh max no eson enti mean say what oso ha na wa chia ni say na wa cross no sa ye hye max ne sa se eson a o be chechire e wo eto no te say de ma chechire we no sa ahwefo hwa te say de ma chechire wa ha
o betimi ayi ama ya hwe se de osi achechire na
o be chechire ni say se eson a o be chechire
okay
but yen cross max no o cross na ekwan ebede dan ho no ekwan ebede dan ho nti yen enti na fa ni face mask no e wo se e cover ohwene between wani ho no ene e wo se e cover ho e fa obodwe ase ni sei
okay
yen bo max enye ni sei
ti yen hye ne wo ya no nko a
yen hye max e wo ya no nko ana yen hye max e wo ye hwene nko a ye de kata be bia wo se e kata be bia na wani no pe na e wo se eba na ade ba ko so a me hu se about max a Ghana for bebre edifo e wo ho ne se max no edru time ne yen hye mask bibi na asi ama ye hye max
no
ha intino e wo se otimi e de hye wa adwum se max no bibi na asi intina ye den ye hye max no na dada ne yen hye intino ye besre Ghana for ne ahwefo nyina se max na wo se ehu timi hian me share video bi as a first a covid by face mask no oba no wato atwene no wa wohye ba se sei okwa abonten a oh nose mask akohwe na konya ase bi da ha na wafa kita say police issue na obi say nose mask we intino ya ade ba ko a e wo se ye hwe ho eyi pa
na ade ba ko a maybe say max no e show na opese o num so ana o yi no briefly bi ha obi o ha o won say wayi na e bona body ase obi o ha o yi kra na be bia o de bono anim na o de e kata na no e hwa no sa de eto akonya na ase table so obi o so yi ya na ne ekitare nsem se ya owie ya na o sa de ahye obi asawa wa menku kra so obi kra de ebo ne mu maso da otika mu no to nsu anom ne wayi abo ne mu maso enti se wo pese wuyi abra wo be sa ahye bi ma sai na obesi aye no
okay face mask no te sere me kan no yenso enimu yenfa yensa enso ha odo nsa so ha urefi na wo de ko wait when asike kana wo ko ya utimi infection ti fansa shem say ni ni ana say odo nsa hye say no we ya ba say
okay okay
ha ana say obetimi do nsa tu no
ayi
without anymore no touching anything
okay
without anymore no ye hu ne say anymore no aye contaminated aha no aye contaminated
it's no say on sakra
eba aha no ha
Osei enkomo no ya de na ensɛm a yɛbɛka ho asɛm no nso dɔɔso baabi a ehia me kɛse ɛyɛ o time as a frontliner time a mo yɛ contact tracing no na sɛdeɛ medi kan si kan ansa na yɛhyɛ dwumadie no ase no yɛwɔ Dr. Davidson ɛne another health personnel bi nso a yɛne no ɛbɛtwetwe nkɔmmɔ afa COVID ɛho na sɛdeɛ me saa ɛka yɛ no nso dwumadie no yɛne mo a na ɛdi ɛnɛ yɛpɛ sɛ yɛte mo nka ɛnɛ ɛnyɛ mo na mbɛbisa yɛ questions ɛnɛ yɛbisa mo mo COVID experience mo share with us na yɛnredi ɛma yɛahwɛfoɔ na ebi mo de messages bi aba a mɛpɛ sɛ yɛbɛkan Akwasi Poku say you guys are looking good ɛna message wey deɛ me deɛ nti no was you only light nso wɔ hɛ yo Akwasi ɛda wase ɛna Kofi Flex sɛ menya din ni ya ɔse fix it me yɛ sure sɛ ɔka yɛ time ne ho asɛm Kofi wey deɛ fa kyɛ yɛ na yɛbɛbɔ mmɔden na next time no nsi saa biem nkɔɔfoɔ nso de love emoji bebree ne fire emoji yɛda mu nyinaa mo ase na yɛntwa yɛn ho mbra yɛkɔba a ɔsɛ o experience with COVID yɛbɛka o experience as a COVID frontliner yɛbɛka ɛho asɛm na yɛkɔba nso a yɛne Dr. Davidson ɛne yɛ health personnel baako no nso ɛbɛtwetwe nkɔmmɔ yɛntwa yɛn ho mbra na yɛnto ankɔmmɔdie ne so Yensama mo akwaba Embra Gift of Health dwumadie so se afei na wode wafidie no ato anasa afei na wa join ya ene ye ka COVID-19 eho asem ye ka the other side of the story ye ka experience with COVID ene as a country and as a continent and so no are we doing well yenya health personnel baako ewo ahomane so ayene no eba abedi nkomo na last year when we were hit by the COVID no unfortunately he got infected in his line of work no he got infected and ye be say yene no ebedi nkomo afa ne experience with COVID eho Abrante hello
yeah
good afternoon.
Good afternoon.
Na apomwe.
Nyame adom na mozo.
Nyame adom boko. We dey yebeda wase say ye frɛ wo oje ye frɛ so say oni ye ebedi enkomo. Bibi enti no ye ntimi mfa udin ene baabi a wo ye adwuma entudwa. Na ye bebisa wo nsɛm kakra bi about COVID because there are so many myths about COVID-19 no ebi say eni ho ebi say
okay.
say any say enti no ye be pese anka wo be kaya emre ben na o ye infected with COVID-19.
Hello.
Hello.
I think the line very bad.
Okay. Me director mpacho obetimi awake on network na my kakra. Hello, Kelvin.
Yeah, hello.
Yeah, what say and say the muye.
Ah, okay. I feel kaka.
Aha. I say every person ka behu time senka obe kaya time we infected with COVID.
I think the early part of June.
Early part of June. And
Early
we
part of
infected
June.
with COVID. Now contract anyway, was it at work and I said now fear na unya COVID no?
Oh, it was very scary. On the yare afina aba o man bi mu na yehu yenya no dru obi anim the way and student the ban city. Na you being the first person who contracted disease, you know. But I wasn't feeling any say be obey and I obey but the na minti and say be minti unti taste be unti any smell around the environment be
unti say we spray na we rice bibia the same. Hello. Yeah. Me say me who say na unti hwe unti bibia pampan na say
no. O sense of smell ni na off.
Off.
Ni na be off.
Who say we watch it, you know,
o sense of smell ha na what say bia imusi ko nti no o bo nti o so sorry ho. Ana say bia ade bi bon ha. Nti o so sorry free ho ana say o be pade na free ho. But this whereby onti ubetime agina refuse dam so kra so na onti hwe.
Hey. Eni na ehu. Na unya ne wen unya COVID no wo adwuma ma bra wo ye adwuma na se okofie koye wa de bi na emu ho no unya ye adwuma na unya ya na se unya ne fie.
Oh during working hours.
Working hours. Okay.
During working hours.
Okay. Na we infection no echeye edi na be say
infection it depends on from what I have seen and I say what I have observed with COVID no. Obinya infection na it depends on the strength and how they recover. Inti ni ensure ni ample time to say be a 2 weeks, 1 month, and I say be a 1 week. Unlike be a malaria, obi fa a draw for be a 3 days within the next 5 days na or recover. Inti depend on the strength. Minimum be a staff back it took him almost 2 to 3 months for him to recover because when you serious cough. But me then it was just 2 weeks.
Okay.
I'm be for 2 weeks. In quarantine, social distancing for 2 weeks. But still, I was home for a whole month.
Okay. Okay. Enti dear no in your case no na pampan nko asem na ha adwen na asa na bibi fufo bi ka ho.
Oh, Debbie. COVID na gasa no. The anati say the symptoms they do best start no. Na eno na say ya ka ho. Na the sense of smell no any taste depending ni ho.
Okay.
No penny no na men coffee menya kata me feel weak. Me home okay, my breathing was okay. Bibia fine, but who did I want to na bibia smell bia so any leakage around bia say bia gas leaky kwa na but want to
okay. Now let's talk about treatment. Ye je wo to hospital ema unrobi and asa wo de no na wo fie na wo fie nso a no ben na wo no me a ema wo hutimi to.
Okay, at that time no na remedies to it na no azithromycin.
Okay.
We take azithromycin for 1 week. Now we will issue zinc tablets and vitamin C. But now the one with the combination of the vitamin C and the zinc tablets no. The other lozenges the only two show man hura na eno ankasa dilute with the water no na one. And I do hope say ubenya a balanced diet to help boost your immune system. So na be bit me fight COVID no.
Okay. In wo case no ya hospitalize now on that hospital.
Hello.
Yeah. Wo case no now the hospital and I say na wo fie na wo gi treatment no.
No, I think the mama be fee no. After treatment na me be fee. The original original health directorate no will call you. They will give you a the facility na the whole number be ma wo mo. Say be o manya reported case be. They will call you. Say be a no. How saying how she feel. Say intense there. The ambulance be ba be foul.
Okay.
Nobody call near the woman now call Jusso. New treatment center or Jusso and the severe cases near the mobile to Nswagu.
Okay.
But my friend be the neighbor at Nswagu because I'm the severe.
Okay.
Or coffee to say be a TB.
Okay.
It's not very severe and I'm breathing patterns or so. But other relatives and our family members in the woman now call treatment center or Jusso.
Okay.
But me no make say be with the taste and then smell no pen. They ask me to say me confine me home baby and I should not go outside. I should not be in contact with anyone. Me am quarantine home fee.
Enti after no who say who ato no o say test ni bi confirm say ampa we negative and I say symptoms no call ya na aka say we dey ene me ho atom nti no.
Well, I think that with first test na dey once by COVID test na nkasa na ne boarding nti na facilities need to mean fund for COVID test no, so it was the government who was funding for the first test no, but second test na dey either say the health staff dey na facility no bo mo dey say obe funding for second test no.
Okay.
After second test and I say also a positive third test they can cover up for with the payment for the second third test.
Okay.
But after second test no say negative.
Okay. Okay. Now after no when your complication be
What's it
when your complication when your COVID-19 no complications be
say with research me symptom nipa ne benya no once obi o ha ne de be start with cough obe coffee odidi okay the sense of smell okay the BBI is fine but bo se cough no obe covid no obe recover na cough na kan so my friend need a particular example of it honestly after recover from COVID no is he has been having a chronic cough as when room temperature near cold pet na say or coffee kakra but or enye to say bia when ya what dust mu na bia afana so ama or coffee.
Okay
now most of your sense of smell and taste no e call you know is he out take kakra but enye and to say before I take a but before so I don't a strong scented a strong perfume it be a spices and those kind of strong things you know and yes I
okay
and I'll taste you know, more or less like as I would say what is salt and pepper no pepper and then chine pe nti on la don say bi ani so taste den me ko den chine nko a the other ingredients are no na me bi ani ne yede Sani money na no. You wouldn't until na.
Na say COVID no complications. Unya we kwa na complications ewo.
Into complications of COVID you either have a symptom like a bit permanent with you. But the impact also no ebe from kakra.
And even after COVID no, say some complication no ebe wo for some time and I say that day nyina confirm say that day nyina
well you free at as versa so there. We are still experiencing partial symptoms of COVID. The partial symptoms are to say right now the sense of taste aba. Aba but and to before and son also before and son obey no sense of taste no sense of smell very good. But the moment I be na say I bibi oh see and me didi I me feel okay obi a didi I be feel but the sense of smell na echo one pattern. Okay. Say I can't differentiate between 2 or 3 perfumes. But they make what I say. What do you mean differentiate between 2 or 3 perfumes and I say a smell.
Okay.
The what you say a smell, but so we jollof rice, we have fried rice, we in katenkwan, we see. And smell no dey ni na call one person just say what you the scent keke. But as to say or smell be more differentiate say obi here like soup bi wa ha and as obi here jollof bi wa ha no different. Okay. Say animal but obi say obi here diane wa ha diane smell agi ha and as be ha bon and as bi sa
na we maybe so facility ana oye adwuma no ho ana wo da so. Hello facility ana time are we infected now no ho ana da so
o say time ana me wo
baby ana oye adwuma time are we contract COVID no ho ana wo da so ye adwuma.
No. It's the me free ho.
We free ho. Baby ana owo answer na o free way. Ho na rank here dey.
Me what you say?
Ho na rank no or rank. Benim say nurse no yes say more ranks ewo. Ho no na rank na here dey.
Like rank. Rank with nursing and
yeah.
We started working in rank and we start with a staff nurse.
Okay. Staff nurse. Now early days of employment, right? And as
early days of employment.
Okay. May can about be see as so. If it was your early days of employment, meaning say na for that time no now salary right? Now salary nyamba. Entina hospital na say government support mu abra mu nya COVID na.
O say na facility no na say government emma support be during or time of isolation no. Munya support be from government na say or facility. Well, facility the facility didn't give us anything, whether to support for our drugs or say we be kakra to compensate. Say we are renting or be a jitter drew kakra na no. Yeah, we absolutely got nothing from the facility.
Yeah, mamo she. Even though unya yare no through service to facility no, but facility no ense ni no mo nse ni treatment ni anase se wo beto drobi kwa na omunim ho hwe kwan abefa so abeto no, even though you were a new staff and na o salary nso nyamai.
Oh, the facility na amfani for because me kai say drugs I'm taking with as that kind of not azithromycin why because people are buying it in bulk and almost stock it. Now could be at our bread because now be able to say azithromycin a day 50 covered the year. We be nominated for prophylaxis and also be nominated before say or obenya COVID no. Nti na ehwan is scarce kakra. Nti a friend, a very good friend of mine, and a kotobi or turning bulk no the or the breme. And auto vitamin C in combination with the zinc tablets and Los Angeles no. It become on the breme.
Okay. Okay. Now, what about the government? I mean, misal government, the answer na yenya o ma onko. What about government? Because me say hello. Yeah, me bisa say na government nso munya support be from the government because me say
government didn't come with any support fund. But previously, ni atete say it be a certain amount be a meeting fund to on there, but they say be some reasonable amount. But no musa. But the health directorate no take your details, your bank details, our ranks, your dean, be there. But we are just hoping say but from COVID from last year till now, I don't think so.
It's been a year, right?
Yeah,
in June 2020, and I July 2021.
It's been almost never say a year crack.
But a bimo and more relief package, you know. A bimo and relief package, you know.
Relief package, no, almost a kind in with last year.
Okay.
Monsaka within the COVID period, but after that day, meaning will be a Ninsaka, I don't know. So these are Canada, I mean to mean, but amongst in our facility, a munya disease, meaning Ninsaka Canada.
But I believe say there are measures in place. Say Ebebuama Monsa Etimiaka what hello maybe say measures be in place say Ebebuama Monsa can more relief package ana.
Well, measures today, I want to say it's not with the facility, no. Now could the regional health directorate in itself.
Okay.
The region was handling all those things. Dealing will be a Zoom briefly with CBA Monsabe Canada say, and I see I started here. But Nipa say in a young modi and TBA, we are paid it in batches in TB bedroom or so. And I say do was and TBA from nobody.
Okay.
We are also going about our normal duties because all this admin wouldn't really help. And quite a year admin free so that.
That's it. But me won't say during COVID no Ghana health service no was very dedicated. They were selfless in their duty, making sure say young nipadodo na anye infected enti a crime is where me yakakra say in your line of in the course of offering your service no oye infected na ebesi na mwa bia emmaye na ye beda wase say utimi ebeka yensama ye di dwumadie ye beda wase pa na
okay
that chibia no bibia ni a ye besa edi nkomo ye beda wase
okay so me da so mo ati for ne wabeja phone na
relief package no osaka yesrewa kai why kai ni nyina why
mate
okay that's it. Bye bye. Okay, so let's get back into the studio. But say after now we're joining this is gift of health. Now we are discussing COVID-19. And I say we are discussing the myth, the fear, and the truth. And we just heard from one health worker. Mega say we just heard the hard truth. Say in their line of duty, he got infected. They were promised some relief package, but up to when it's been a year. It's been a year, a whole year. But omo ente bibia, there be a betrayed, but there's been no relief package for him. Let's get back into the studio. In a short while, no, Dr. Davidson so ebedin komo kakra. But Osei, the entire me boss me so ye nyina ye hu mo during COVID era. Enti say in your line of duty, nya COVID. Na ye guest you class me kwa no. Ose no say new staff.
Yeah, I know a couple of people are contracted. I know a couple of doctors, I know a couple of nurses, public health nurses, community nurses are contracted. We know Emma, yeah, the list to be by Uchroding, no watcher or rank, no watcher or bank details. Or bank details. Asha home. Since a year, I think Cross almost had a second list cross our buyer, but nothing has been done on this. Emma Bako say Ghana dear. Oh ye bibi abwa ama country na koso na say oh ye wako contract at least the government should tell you something. But and Juano nenye Jumaketo seriously going house to house. You find say person A enye bia. Number of people are getting into contact. When a jumam ni fie, you have to follow up on those people. You have to follow up on those people. Say na nipa na ono so ni omenya contacts no. So how are they feeling? Are they experiencing the symptoms? Are they exhibiting the signs? So enye juma ketwa and time immigration for so the list by people are coming into the country. You have to call them and follow up on them. So enye juma ketwa na oye ejuma we na wako contract yare we na obeye den na government and some ma any form of we are. You see,
I knew a couple of people bia na omo eka front liners no minimum and a minimum other guys being so na omo kan ho. Maybe complaining say PPEs no it wasn't enough.
I remember one time on say when you are visiting an infected person but the symptoms is asymptomatic or exhibiting signs but why isolate it will feel. Now you have to be in your full gear.
Okay.
Because gear ni be ni no. We go in teams like a team of 4. Maybe 1 doctor and 3 nurses. So you kwa PPEs ni ho tetimeka say oh any mama doctor we nko an enye den enko if say others ni PPEs oh mama nurse we enko an enko patient no but that's not right. Gloves anyway you count it say oh and then what the gloves 50 and they call out look at this
I'm say and some no endorse but I'm ready to know I will say you benya a platform be maybe hopefully after your discussion your platform no would still be available until obviously will share your thoughts and experience with us we wait in their far your Facebook platform so at Victory TV. Say you benya Dr. Davidson ye misano ensemfua mienu miensa bi say Dr. Davidson aye ready wa homane so a ye be bisa but answer na doctor beba no aka enema mienu pa mpese me bisa.
Okay.
The title me pese e kan asem ye third wave na aba no.
Yeah.
But clear air ne mame. Ebi mo say COVID-19 it was a myth like happen crowd because obi catch me say no protocols ni nyina no safety precautions ni nyina no one practicing mu ba kokra but he's okay.
Enti nyame a osom no na age no de meka no cause obi tun say covid ne de enya real covid ne de enya real me wo ka sa akyerɛ me a na maka kyerɛ say during covid time no unya ho a na nka wafa car o me call atonsu Kumasi South hospital akwa covid patients are na go. The place was so full.
More that ventilators.
Yes, so. The place was so full. Empty. Car park hop and a on military tents in
no. Wow.
Yes. Equipe we near call twice a week. And near KCCR. Take near just samples no near the call. Okopana who cars are line up from various districts are on the samples. Eba. Oh, Sana. Na mushishifi. No. People were really dying. Minimum for many who they died of COVID. So, omo ka say COVID ni omo kra ne bonus marks ne kese no. Omo na ehoro omo nsa apply sanitizers ni we. Nti no ono omo sa omo akumam omo nimpa say COVID ni wo ho but can omo nka. Yes. Omo nimpa say wo ho but they don't say it.
Now, no, you only 8 minutes.
Yes.
Yenka, the third wave in the First, we were hit by the first one, the second one, and now we're experiencing a third wave.
Okay.
Fortunately, and yet, all the parts of the world now experience it, but there are countries where they've been greatly hit by third wave. No. One country buy in mind so easily, India.
Yeah.
Yes. And you see variants and also no, there is a new one. Be simami no.
Okay.
Chere
new variant no. Your friend omo edinya omo dia man Delta variant. Yes, and it was first seen and I say you ne kane India. 20th October. Like okay. October last year 2020 they just say new variant the third wave you know October and the thing about viruses they say they create resistance na omo dane omo ho omo dane omo o manipulate omo na omo dane omo ho and India is one of the most populated countries in the world. Practicing social distancing, practicing the standard precautions, even the second variant, they say a Honor is free by, and a penina must be free Wuhan, China. It's the third wave, the Omo who were India, Omo who were UK, even Ghana. I think said just last week, Minister for Information, Honorable Kojo Ponkroma, Ebeka third wave in the yes, Omo who were Ghana. It's the third wave is there. The third wave is there. They make a check after phone and said the third wave is there. And my fan she team say COVID no anyhow. And the money who say third wave no omu community nim. You get it? Nipa our community omu third wave no. You who yeah. And yes be a travelers be and a sa. Yes, it's the make a charge for and say, yen share how your boy your max, your washi and sa honey enjoy. Yen twas or sat said ye time ana yareno, iginemuno.
Simabako, yen fanka vaccination no one.
Yeah,
less than 1 million, right?
Yes,
less than 1 million of the entire population of the country.
It's a
a vaccination. Yebeka vaccination no has but answer na no your Dr. Davidson ewo ahomane so doc. Hello. Yeah, doc, good afternoon.
Good afternoon.
Na apom to say
Apomboko na mwanzo
nyame adom ne mumpai boy kitamu nkakra wa ha na yɛbɛda wase sɛ waba bɛka yɛn sa ɛnɛ enso ebiem yɛmmerɛ ne kɔ paa yɛmmerɛ ne kɔ enti yɛpɛ sɛ briefly o ka na Osei explaining the third wave no yɛsɛ covid no biribi wɔ ha yɛfrɛ ne third wave enti onim deɛ kakra a wowɔ fa third wave no ho no anka wobɛdom yɛ na wakyerɛkyerɛ mu akyerɛ yɛn ɛne yɛahwɛfoɔ.
Okay. Wait there, we shall it here for you. Hello?
Yeah. Dog yet
we shall it here for you now. We COVID now. I know understand the COVID related as a COVID na COVID you can be say upper respiratory infection.
okay.
Right? And I mean from Munaya.
Okay.
Commonly sana COVID never. Na ye nyafi abobi a friend a SARS virus. Now it's a virus ne there will be of different strains. Or the new one crab back I friend the Delta virus. Now with COVID no. When you get to the COVID now, normally signs and symptoms now show obiane they were ne others show specific symptoms, others don't show specific symptoms. First, initially, we thought it was just the headache, the cough, the chest pain. But it's not only a BS and a car. Obo how to mean diarrhea. Obo to make a choice say your friend is saying BM and MA because we are noticing that the COVID trend now it is actually varying per person based on your immune system.
Okay.
That is what we are seeing now. Until COVID is still around. It's still around. It's very, very around. Now, recently, I'm sure we are seeing new strain now, if in the harbor now.
Yeah.
Now, people are also presenting in different ways. Also, go COVID psychosis. You can't COVID psychosis. As I just said, you know, ono kasakra, it doesn't make meaning.
Okay.
To go also to make a choice say, no, why malaria symptoms. Once then the person starts exhibiting signs of a psychosis now, make an ono kasabons and ono so. Ubisana Simbia no so na baby. What me be say and then you see a different story altogether. Into obiso then obiso to remember just with diarrhea. Over checking and COVID near then positive.
Oh.
So now the COVID symptoms now they are wide across. They are very, very widespread because when mutation happens, what happens next one strain and another strain. You can't strain that means the same animal groups of animal no. Let's say or different types of snakes. What I say now, Omometia produces different type of different venom. What I say.
Okay.
So the same group, but different strain. Until when they mutate, then the symptoms change. Also to make a choice, makoma and just with signs of heart failure. Or by checking na COVID and respiratory heart failure. We see a liver. It comes as different various forms. So we say, how do we prevent COVID? You get it. So it's the same safety protocols that we are using. Social distancing, covering your nose, and also how do we call it, washing of hands regularly. That is the only way as of now we can prevent COVID. And now with the idea of vaccines, the vaccines are also there to boost the immune system. Okay. What the vaccines do is it's kind of make it like, say you are having the COVID, but you're not having the COVID. So that when they come and one will be a motor bind inside our cells. So even when the COVID need began, I want to run more because the receptors are preoccupied. No, so you baby started then. Into me, my then COVID need. So what you say?
Yeah.
So that is how now we are trying to advance. That's why every now and then there are new protocols. Say this is how we go about the COVID management.
Okay. Enti briefly na answer na o join and na me ne Osei ka vaccines ne ho asem. Article bi ana me read say less than 1 million of the entire population of the country and ya vaccinate omo. Is it enough? Enough?
Okay, so with the vaccination it's not enough because we call something herd immunity. Herd immunity, the more you vaccinate people, the more you protect the vulnerable. Or what I say, Ghana is so close now. Our population is close to, let's say, almost 40 million. What I say, and if we are vaccinated just close to 1 million people, there is a huge deficit. What I said, that means that we are giving chance for kind of mutations to go on. That means that the person who is vaccinated, even though the person won't show it, what of the other people who are infected with different strains of COVID? Now, what will happen this time around is that when I give you the shot of the next vaccine, you realize that the vaccine might not work because the herd immunity principle is not going. But if we vaccinate about 90% of the population, then we can protect the 10% of the population.
Okay. Okay, protocols be home asem. Safety precautions be. Now okay say within time biano ebi sisa ebi beka ho aboa na nkasa ye hu ni su. Enti no obetimi ama ye niam bi ebetimi aye ye contract COVID no.
Okay, so as I said, now never ebetimi I say the social distance very, very essential. Number two, get the right nose masks. About me use nose masks in about 2-3 days. And one thing I've noticed also, the thing is a nose mask. Nipana kata just the mat and a wija no. What I said. But the thing is to cover both your nose and your mouth. You get, because that's you breathe in more air through your nose than your mouth. What you say?
Yeah.
Then the next thing is to hand sanitizers. What you say?
Yeah.
We have to try and get our hands or hand washing, frequent hand washing. That is another way of preventing it. And the social distancing also. It is very, very important. It's so sad, say now we don't see the social distancing like first it used to be, but we will still encourage it and reinforce it.
Okay. Radio dog, ye beda wase ye emfansi ha na ye mre no enti no nyame ya adoma na oche senne ye be sheshu na se ye bedi kan afro na kaka bia no
me das me charity for nyina
ye tiefo asobete ye ne Dr. Davidson our 37 military hospital ena ehwehwe nkomoy back to the studio Osei dog aka bibia na you ever see a wrap up show?
Yeah.
Ain't or last thoughts, any comments on?
Okay. COVID number will be a negative impactor. Anya and so health wise, to say the dog kind COVID psychosis and then could psychological trauma and yoma and economic impact. So Mr. COVID number must Mr. D and yoma be. And it was say it was positive. Did the be an room as what say and carbon emission cars full and from any say come in from our papa home and you know BBM not to say Bible can be more faster than my positive impact about no negative impact yearly workers off near the you know I know na me wrap up and na Dr. Dab akani na no you be maintaining social distancing no ya wash and sa ya use the proper nose masks no and I think say bibia ebekoye amaya
really Osei ye beda wase
okay
ye beda wase say ene unya amre be kire yen COVID-19 the myth the fear and the truth ye beda wase nyame enhra opi
amen
mene Osei Agyemang oye registered general nurse ewo Menchia Government Hospital and a train come in the studio today about COVID-19, the myth, the fear, and the truth. Also, no health worker bako join to share the COVID-19 experience. And Dr. Davidson, our 37 military hospital, and so the knowledge about COVID-19, and so ebe boa jumedi. Yebe damasi say moje mre na mo share yen na ansa na yebe kono dada jumedi. Nipa kuobi ena asoya sene na ye di se dwumadi enti se onso wo pefa se obeboa yen na ye di dwumai a obetimi afre ye ewo 02465 14923 024651493 anaasɛ frɛ yɛ wɔ 0244 631 203 0244 631 203. Yɛbɛda mo ase na yɛbɛda production team no so ase me chief engineer any assistant junior and floor manager Derek yɛda mo ase ɛwɔ medwuma pa mo bɔ de boa dwumadie yi so meda mo ase me mo guest host dia bonsu nyame yɛ adom a na wɔtwe sɛ ne yɛbɛsɛ hyia na ansa na no nipa mienu bi wɔ hɔ a ene dwumadie yi me de ɔmo na ɛbɛwie Kofi Echampon Jefta Kofi Echampon ene Akwasipoku Jefta ɛwɔ Obuasi Municipal Hospital ɛna Akwasipoku ɛwɔ Komfo Anokye mesrɛ mo ɛkyena mo nkɔ asɔre Jeff ni Akwasi mo nkɔ asɔre kyena meda mo ase na wɔtwe sɛ ne yɛbɛsɛ hyia.
God said in His Word that He is a God who will heal us. He is a healing God. But I know you might have questions about why this person or that person did not get healed. I have questions, but it doesn't change the fact that God said He is a healing God. And God and His Word are one. They're the same. No one here would doubt if God came into this room and touched you that you'd be healed. Same thing can happen if the Word touches you. His power is in this Word. There's power to heal in this Word. There's power to save in this Word. There's power to deliver you from that hopeless situation. Let's put His Word on our lips and sing it back to Him tonight. Heal me, O Lord. Sing it.